On this episode of Resilient Business, I chat with Dr. Lisa Fortin of Reyouvenate in Petosky, Michigan. After years of working in the traditional vein of medicine with an extensive background in neurosurgery research and radiology, Dr. Lisa began to experience brain fog, pain from underlying chronic inflammation, and extreme fatigue. As the chief radiologist at a renowned hospital and a mother of 4 children, she knew she had to help herself, or else she wouldn't be able to help anyone else. At that moment, she decided to heal herself using advanced regenerative medicine techniques. When Dr. Lisa started practicing regenerative medicine, she was amazed by the results. In less than 2 years, she reversed her biological age by 20 years, eliminated brain fog, and alleviated all of her painful symptoms. She also helped her husband recover from his traumatic brain injury and her mother eliminate crippling back pain. Dr. Lisa now serves as the pioneer for regenerative medicine at Reyouvenate in Petosky, Michigan. She was passionate about becoming the first doctor to open an advanced healing center in the area so that she, along with other health experts, could transform traditional healthcare by offering non-surgical, non-pharmaceutical recovery options. I think you'll really enjoy this conversation with Dr. Lisa. If you like what you see on Resilient Business, please like, comment, and subscribe. Please share this thing far and wide and check out my affiliate partnerships below for some great products and great discounts. Also, if you're interested in learning more about how Pulse PEMF can energize your life and or your business, please hit me up on any of my channels and we can develop a solution for your specific needs. Here's Dr. Lisa Fortin. Hope you enjoy. Dr. Lisa Fortin, welcome to Resilient Business. How are you today?
I'm well. Thanks for having me, Joe.
You're welcome. Thanks for coming. I've been meaning to invite you on to the show for quite some time, and finally we're able to put it together, so I really appreciate it. I think this is going to be a great conversation. Why don't we jump right in and talk about sort of your journey leading up to where you are now with your business. Reyouvenate is the name of your business, and we'll talk a lot about that. But what was kind of the journey you took to get there to where you are today?
Yeah, I think it's definitely a winding road type journey to get to here. I started in biotechnology and research and became a published researcher. Quickly learned that that's not what I wanted to do day in and day out, was be, at the bench work or that aspect of research, but really enjoyed working with people and seeing changes in their health. So I did go on to medical school after that. And from there went to radiology. And radiology to me was an amazing field because I really got an X-ray or inside look at the body. And I saw some fascinating things that really fueled my desire to become more in the regenerative medicine space. Specifically, for example, maybe somebody getting in a major vehicle accident and lacerating the liver, shattering the spleen, they take into surgery and, the life-saving measures most likely had to get the spleen taken out. And then I had the privilege of watching these people heal on subsequent CT examinations and follow-up imaging and seeing the liver laceration heal, or if they had to take part of the liver, see the regeneration ability of the liver. We would see these small soft tissue nodules coming in the splenic bed, which are called splenules, which are taking over the job of the spleen, which has shattered and been removed and still working the body's amazing regenerative potential. And then there were some things that I just couldn't put my finger on and understand why was this stage 4 cancer patient getting into complete remission, when others are rapidly deteriorating. And so there was a lot of pictures of health through radiology that were, sparking my interest into the regenerative space. And I actually had my own health issues I was dealing with. I'm sort of a go-getter. My husband and I have 4 children, and we had 3 of them during residency, 1 just before becoming a partner in radiology. So a lot of stress, kind of chronic fatigue, and the subsequent health outcomes of that. I had these strange rashes appearing on my face for actually years before we sort of nailed it down to. I had a lot of intestinal permeability issues, and I had developed 4 pages of food allergies by the time I figured it out. So everything I was putting in my mouth was causing inflammation, including turmeric, which I thought was an anti-inflammatory. I'm trying to reduce my inflammation. I had developed even an allergy to that. not getting the answers that I needed through the Western medicine vein that I had been trained in, and really quite, suffering my health for what I felt was way too long, for years. I would call it mommy brain, but I had brain fog, I had inflammation, sciatica on the left, and then all these kind of facial skin rashes and such. So finally nailed it down to that, kind of healed my gut and really opened me up more into the functional medicine side of things, along with regenerative medicine interests. And, at the culmination of that, when I finally felt I had healed my body, which was 2017, I did a test. And back then, the test to look at your biological age, kind of more standard, was the telomere test, where we're measuring the cap on the end of the DNA. And at that time, I had been 37 years old, but my telomere age was actually 59. So I was at the worst, the first percentile. I mean, the worst of the worst for all people measured in my age group. And this was a real red flag to me, but also something that sort of fueled my own fire. And what I often say to people now is that, health or degeneration and aging, those two things really begin at the cellular level way before they show up at the clinical level. Looking at me in 2017 didn't look much different than I do now. You would have thought, well, she's got a good bill of health probably, but really at that cellular level, I was suffering. And I knew, had I stayed on that course 5 years down the road from there, I would have been an autoimmune disaster, and who knows what would have happened. So really awakened me to the power of this regenerative potential of the body. Each of our cells has the ability and has the programming for repair, regeneration, waste management. Sometimes we just get in the way of that. And putting your body, back into balance and allowing the cells to carry out their programs as they should is really what I feel like one of the keys and cornerstones of health that maybe we've missed the boat when we're really taking this systemic, systems-based approach in medicine. And so I did repeat my test, about 2019. And had reversed age at the biological level. So I was then within 6 or 7 years of my own age. So I often joke, each year I become a year younger biologically on my birthday.
Sure. Yeah, that's not a bad job if you can get it.
Yeah. So that sparked, my own health concerns. And then my husband had a traumatic brain injury in 2016, which we recovered with stem cell therapy. And he's, back to baseline. He really did have a lot of the post-concussive mood swings, hormonal issues, light sensitivity, a lot of things that came from that. And then, rehabbed my mom's back pain, and just kind of went from there doing a lot of my own family. And it finally came to the point where I thought, I really want to bring this to my community. And 2017 was actually the year that we opened up Reyouvenate. So.
Yeah. Excellent. It never fails. Whenever I talk to someone in the wellness side of sort of healthcare, if you will, there's usually a personal story leading them into now what they do for a living, so that they can offer the same type of, hope basically to individuals who just don't know where to turn, perhaps. So it's really inspiring to hear over and over those types of stories, especially when they turn into a successful model that now you can share with others. So I really totally appreciate that. So Reyouvenate. So you went ahead and you started your business. Tell us how that was and what it looks like today.
Mm-hmm. Yeah, so we started in northern Michigan with a very forward-focused practice. So it was very interesting to start in 2017. We do advanced healthcare with a focus on cellular health. Mostly it could be in the regenerative space where we're repairing or restoring function to tissues. It's an emphasis on non-surgical and non-pharmaceutical healthcare. So we started, part-time in 2017. I was chief of radiology at the hospital at that time, so I already had quite a big load on myself. And we both, my husband and I, just kind of threw around the idea of maybe this clinic would work up here, but we wanted to be sure before pulling the ropes on all of my other career pathway there. So yeah, it took off. It went really well in 2017. And so we opened in September And then by May, we were full-time. So 7 months later, we were full-time at the clinic, and had kind of walked away from what I thought would be my career in radiology. And I wouldn't say walked away. I often say repurposed my radiology skills.
Sure.
I did diagnostic and interventional radiology. So all my procedures are image guided, and had a lot of practice, because of that career in that vein. And really the whole emphasis of the clinic, I would say, is to know your options, because I feel that we don't truly give an informed consent when the informed consent should talk about the procedure, the risks, the benefits, and the alternatives. And I feel like the alternatives are just usually in the vein of what may insurance cover or things like that, rather than truly knowing what are all my options in the health space. So that's something we really push through the clinic, is this kind of know all of your options.
Sure. Yeah, definitely. And what percentage of your business is still insurance based, if any, or are you all cash now?
Mm-hmm.
Yep. All cash. Okay. Excellent. Well, great. So tell us about some of the different things, or maybe tell us what a new patient might expect the first time they come to Reyouvenate. What are you discussing, and what are you sort of sharing with them?
Yeah. So this is, I love the question, but it becomes a little hard when people come for all different reasons. So we do regenerative medicine, with platelet-rich plasma, zinc stem cell-derived exosomes, some little stem cells here and there. But I would say the majority of people come to the clinic for pain. Pain is a great motivator. I also have a whole cohort of autoimmune disease clients, fibromyalgia, and then just really, aesthetics is the other option. So we do kind of a lot of musculoskeletal work and aesthetics work. We do facial rejuvenation and hair restoration procedures, again, all in the regenerative medicine vein. So typically we have the first consultation is an hour long. We really do quite a deep dive into the history and focusing on what are their goals, and doing a good lifestyle review. I say it's more of a functional medicine approach, where I know that if they come to me for back pain, the only system I'm looking at can't be just the musculoskeletal system. There's a lot going on that can contribute to that. So we were talking about everything from diet to lifestyle and stress management and all of that. So after that first meeting, we sort of come up with formulate the plan. And often we do sort of a trial of 3 to 5 sessions with them. And that does two things, because people respond differently to the therapies. And the therapies are typically cumulative that we're doing. So each session's building on that last session. So within the 3 to 5 sessions, we get a good feel for how fast are they responding, and can come up with then kind of the ultimate plan from there. How many more sessions might it take? Are you 3 to 5 and done if it's just a minor thing or acute injury? And then that's when we would talk about, if you're getting some benefit, do we need to take it to the next step and consider regenerative medicine injection, or are you, pretty advanced where that is an option? And then we go from there.
Sure. Excellent. Yeah. I just love the whole conversation around cellular health and really going after the root cause. And, from what I've sort of experienced and seen in the regenerative medicine space specifically, a few years back, so many people and so many providers were jumping into that industry. And you can understand why. I mean, it's a good business model, and it's much needed, and it's very effective. So it's sort of a 3-prong reason for, people to want to get into that business. But very few have the experience, the background, and the way you just go about doing things. So I think that's a clear differentiator for Reyouvenate in the marketplace overall in regenerative medicine. So I think that's great. And just the holistic approach you take in looking at people's lifestyle and nutrition and what they've been through emotionally, perhaps, and things like that. And I just think that a holistic approach is so effective, and people end up, finally, I think, understanding that some of those methods can be more effective than the ones that are reimbursed by insurance in a lot of cases. And so sort of you get what you pay for paradigm.
Yeah, it's true. It's an investment in health, an investment in a better future for yourself when you choose to take those dollars and put them towards yourself in that manner. So
Yes. It's a lot cheaper to stay well than to, try to solve a medical problem later on. And it might not only be money we're talking about, unfortunately. So, great. So you and I know each other through Pulse PMF, and we met each other probably 4 years ago, I would say. I think when I first started, or almost when I first started with Pulse.
When we launched pretty well.
Yeah, right from the beginning. And so I was hoping to just get your insights as to why you initially included PMF in the whole mix of integrative modalities and things that you guys are using, and sort of the whys, the where are you using it, and what are you seeing over the years with that, if you would.
Yeah, we integrated PEMF right from the jump. We started our clinic with it as one of our options. My husband and I had experience with PEMF probably for a decade before the clinic, just some home units and small portable devices that we had. The first time we experienced it, my husband we were shopping for kids' shoes and he was bent down in the store. And when he stood up, his knee kind of popped and just immediately had pain. And we didn't get it imaged ever. I never did an MRI, but I think that he probably injured his meniscus at that time. It swelled up. He had a joint diffusion, and we actually had to buy a brace for him to get out of the store. It was that painful. And he bought a little portable PEMF unit that runs on a 9-volt battery and just ace bandaged it to his knee. And we were he was, I was in radiology at the time. He was doing the primary caretaking of the young kids and diapers and everything. So couldn't have downtime. And this amazing thing happened with this PEMF on his knee locally, where whenever it was on, he was walking around, he could do what he needed to do. And then as soon as you take it off, he would get a little inflamed and it would start to hurt and throb again and get stiffened up. So that was our first experience with it. And then through the years had used it for rotator cuff pulls, for our family, if they came over with pain, just trialing it. And we graduated then to a home unit, which was a whole bed with little accessories. And always had people that ever, tried it at our house, always had a positive outcome from it. So when we were imagining this clinic, we were thinking, we're sort of biohackers, I guess. I don't love the term, but that's very descriptive. My husband and I have been for decades. And so we took all of the home units that we had come to know and love, and I had dived into the science of and shown that these really do have a good clinical outcome with very minimal, if any, side effects. And then we invested in the clinical grade of those to start the clinic. So along with doing the regenerative medicine injections and procedures, we're using these therapies, including PEMF, both pre, post, and during to prepare the body, support that procedure, and then post-delivery to really continue supporting those stem cells or whatever we're using. And the health of the tissue in general. I've used PEMF, it's a general wellness device in my clinic, but we've used it for preparation for surgical interventions, and people have recovered much quicker. We've used it for back pain, shoulder pain, all kind of arthritis pains, and that has a really good effect with that. And the reason I tell people is that I'm never treating osteoarthritis of the knee with PEMF or treating neuropathy with PEMF, but I am focusing on your cellular health and improving the health of the cells in those areas. And my theory has always been, if we can optimize the health of the cell, then the tissues that they make up, the organ, the system, the being can be optimized. So really working on that cellular health level with the PEMF. And there are very few things that I don't see at least some improvement with the PEMF. And anecdotally, even mood disorders. I have one Vietnam veteran who was a prisoner of war and has had PTSD for, really kind of confined him to his home, night terrors every night, just a really, really bad case of this. And he started using the PEMF in preparation for stem cell therapy because he also had a bad hip, and really noticed mood changes. And he's now been with me for just over a year, about a year and a half actually. And he says when he goes to the VA hospital now, not only is he improvement in his gait and his posture because he just feels better from the therapies overall, but he said even his PTSD, he said, I have night terrors maybe 3 times a week now. And he's like, my overall just, my whole mood has been lifted, from doing these, and he really attributes it to the PEMF therapy.
Wow.
And we've seen great changes with depression. Again, never treating anything with the PEMF, but using it as a general wellness device. I had a head nurse from the hospital here who had retired about 10 years prior to contacting me, and she was referred by her psychiatrist for major depression for PEMF therapy. The psychiatrist knew about PEMF. So we did a little bit of whole body and a little bit of PEMF directed. And she, within 5 sessions, just came to the clinic. And I mean, it took her about 2 months to come. I just have to make the gravity of the situation. And when she did come, was in tears for the first 3 sessions. I mean, the lady just had very major depression. And on about her 5th session, she said, I found myself laughing at dinner the other night with my husband, and I couldn't believe, like, I just stopped myself, like, oh my goodness, I just laughed, and now a completely different person. Awesome. Never had to go on medications, which was her choice. She did not want to, go down that route, and has a whole new, again, a new outlook on life. So, although I use it predominantly as adjunct to the therapies that I'm offering, it's been really powerful, and really people have noticed quite a change. And again, not many people don't have a benefit. I can think of, very few off the top of my head. And the far majority of them just, kind of gave up in a way after 2 or 3 sessions and said, it's not doing anything.
Yeah, I do. That resonates with me because, I think the science suggests that it works. And it works 100% of the time on 100% of the people. The variable in there is how much of a chance do you give it? And that goes for a lot of things in life, right? Yep. You could be well on your way to success and all of a sudden become your own failure in lots of ways in life. So I appreciate those insights. Thank you very much. The
longer the condition's there, the longer it takes to sort of feel reversal of it as well.
Sort of a first in, last out, modality. If it's been there for years, it might be the last thing to come out of the body, and something that just recently happened might be the first thing to come out. I've heard that too in the past. So in terms of, I just like it all around energy, energizing the cells, all of that. I know that's kind of your whole mantra is looking at the cellular level. You've mentioned that several times in the way the body regenerates. And unfortunately, what we usually see is that the body doesn't regenerate as thoroughly or quickly all the time without the proper amount of energy. And so what we talk about here all the time with Pulse and with PEMF is all it does is really pour energy into the body, and the body's own innate intelligence prioritizes and directs the use of that energy, and so it sounds like you're using it to its fullest benefit there. I wanted to ask you specifically about another emerging sort of issue that people are facing, and I think it becomes more important to think about weekly in the environment that we find ourselves in these days, and that's detoxification. How much do you deal with that at Reyouvenate, and what are you using and what are you seeing there?
Yeah, couldn't get away from that. I think it's really important. And I think, unfortunately, it's really something that's relatively low on the radar of most physicians, the detox pathways and making sure that we're keeping those open for people. I mean, we spend more time with maintenance of our vehicles than we do ourselves regarding detox in a way. And the interesting thing on that note is that I find, with COVID and with all of the things that have happened with that, the people that, and I don't know if this is anything that's been more practitioners are seeing or not, this is completely just anecdotal, but anybody who has had a COVID vaccination, even if they had been using PEMF long-term, were very much more sensitized to it. So I had to really reduce their numbers, so they didn't have these kind of Herxheimer reactions or, the fatigue or the muscle aches or body aches from it. But yeah, I'd be interested, Joe, if you've had any other practitioners bring that up. I'm not sure if that's a thing or not for real, but just noticing that. And detox, I think that it's important for people to do daily detox regimens. We're continually inundated, even through the products we're putting on our skin, the foods we're eating, the environments that we're in, and supporting those detox pathways is just so crucial to overall health. I use an analogy of filling up your cup. We're at birth. I think they did a test and there were over 200 chemicals that were found in the cord blood from the placenta to the mother already exposed at birth. So if you think that, you're Superman or somehow avoiding toxins, it's not the case.
Right.
So I think daily detox, and we recommend a lot. We don't have a sauna at the clinic, but recommend doing, sauna therapy as well. But again, PEMF is a wonderful way of kind of inducing electroporation, which allows more water and nutrients into the cells and toxins to come out more easily. And we usually combine that with a binder so that we can bind as many of those toxins which are excreted, and really encourage people to take a lot of water, at least half their body weight in water a day, especially when they're coming to do the PEMF therapy.
Mm-hmm. Yeah, appreciate that. The analogy that I've always used with detox is you wouldn't wax your car before you wash it. And so, you're probably just going to spread dirt around. It'll look a lot worse and be harder to clean after you did that. And make sure you wash the car, get it pristine, and then apply the wax, and they get your best results. And so I would think logically that if you're working with a detoxified, as much as you can, a detoxified person, that some of the other things that are offered there, whether it be nutrition, anywhere, nutrition, exercise, hydration, anything good that you do for yourself will have a higher likelihood of success if you first kind of clean the terrain a little bit, if you will, wash the car, if you will.
I agree.
So
definitely.
Yeah, definitely. Okay. Well, how was 2020? 2020 was a little bit challenging for most, and in different ways, and depending on where you are and what you do and things like that, it had different effects. How would you describe your experience through the events of 2020, and even up to now?
Yeah. So again, I'm in Michigan, so we had a pretty strict lockdown for many, many months with this, and because I'm in healthcare, I obviously couldn't do any procedures. That shut us down for months from doing any procedures, but I did stay open for my pain management clients and a lot of people who had their own procedures canceled because of all the procedure cancellations, just to help them stay a little bit more comfort while we were waiting for surgical centers to open back up. So it was definitely an economic blow, and it was definitely difficult for both my clientele and I. But we made it through, I would say, pretty much, unscathed at the mass level. And we're able to, again, accommodate the people that need to be accommodated through that. I did take the time. I was only open 3 days a week rather than 5 during the shutdowns. And I did take that time to really think, I'd love to get this out to more people. How can I do that? And so I opened up an online concierge program, which just launched this month, actually. But all of that was in the works. So I took the potential, horrific situation and really tried to make it something good out of it. And, the other good thing was that I got to spend a lot more time with my family. I've got 4 children. So it was wonderful to see them more often as well. So through 2020, I think it was a little of a struggle, but everybody felt that. And I really had great support from my staff and my clients through that all. So it went overall really, I took a lot of positives out of that.
Sure. Excellent. Yeah. And a lot of the people I talk to, on this show have similar stories. I have a similar story. I don't think this podcast would exist had we not gone through what we went through, just because I was on the road a lot and realized that being on the road a lot is probably not going to be the future for, as much as it was back before 2020. So appreciate all those comments. In wrapping up, I was just curious to know sort of your outlook on your industry. the regenerative wellness longevity type industry going forward? What are you excited about? What are you concerned about, maybe?
Okay. Yeah. I think in general, the landscape of medicine is changing. And, not just in my mind, I can see all of the interest in longevity and anti-aging. And I think another good that has come of COVID is people stepping back and thinking like, well, where is my health and where do I stand with this in general? And really understanding the importance of having a strong health for both health span and for their immune system status in general. So I'm excited. I see that the trend is definitely, I feel like we're at the front of the wave of a huge wave coming in medicine and longevity and precision medicine. And I feel like we're definitely moving more and more away from the systems-based approach where we're looking at organ systems separate to the root cause kind of whole organism approach more, where I think that clients in general and patients are just going to get a better outcome from their healthcare providers, and we can sort of restore trust in medicine again. Mm-hmm. What do I see as concern? In the regenerative medicine space, there is a lot of FDA oversight and regulation that we work through. So that I don't see as a huge roadblock in any way. I think that enough people are really interested in this type of medicine, and we've got such a great track record in both like the lab work, scientific studies, as well as clinical studies they're all coming through to show that this is very powerful type of medicine and can really avoid a lot of surgical interventions, and a lot of medications and things that may, ultimately just cause more downtime, more recovery, more time off of work, that sort of thing. Mm-hmm. So yeah, the concerns I'm really excited to be in the wave of physicians that are helping people to know that they have options in healthcare. I mean, it's one of the things that I get up for and really fuel my day. Mm-hmm. I'm super excited. I think that there are a lot of celebrities and other people now that are really getting into this type of medicine and having great outcomes and promoting that at a big level. And it's just opening the door for more people to become involved in it and see how much it has to offer.
Yeah, definitely. Excellent. Yeah, I love that. Okay, so if people want to learn more about Reyouvenate, what's the best way to do that?
So the website's reyouvenate.com. We have an Instagram and a Facebook as well. There's a Dr. Lisa Fortin website that just does a little bit more of kind of my story, my history. If you want to work with me, there's different avenues of working with me, either online or in the clinic. So kind of goes through those options. But yeah, any of those ways are perfect. And if you're in Petosky, you can always stop by. It's a beautiful destination.
Northern Michigan.
$1 million month sunsets, and we're right on the bay, Little Traverse Bay, right on the water here. So
I would never rule that out then. Okay. Excellent. Well, Dr. Lisa, we really appreciate you being on Resilient Business today, and we hope you have a great day.
Yes. Thanks so much for having me, Jeff.
Thank you.